best?
I think we're live. We always struggle knowing, but I guess the little word that says live is letting us know we're live.
It's that poor connection. Good morning, USA.
Good afternoon.
Good afternoon, Arizona. And welcome.
My name's Dr. John Robinson.
And I'm Dr. Christina Bosch.
And sometimes people call us...
The sexy docs.
Yeah, no, it's the sex docs.
The sex docs.
Sex docs,
Okay,
yeah.
sorry.
So, last week we talked about peptides, this new cutting-edge therapy called peptides. And this week we want to continue that, and we had promised talking about this a little bit more, and specifically talking about something called thymosins. So this is pretty exciting. I'm kind of excited to talk about it. But I just realized too, we just got back from doing Sonora Living this morning too.
Yeah.
That was a lot of fun.
It was a lot of fun, yeah. We spoke about thermography, which we've introduced here before, but it was particularly important that we bring this topic up this month, the month of October, given the tail end, because it's Breast Health Awareness Month, and of course we want to encourage you all to stay present in your breast health throughout the year. But in honor of this very important topic and this very important month, we spoke about imaging the breast.
Yes.
Through heat imaging, so that you can detect inflammation that could be, kind of like a gift of foresight that says there could be problems down the road because your breast tissue is inflamed. And this ties in well, actually, with the notion of peptides and thymosins, specifically because of inflammation, my favorite
Christina's
word.
favorite word for sure is
general inflammatory processes.
Yes, yeah. And that's because most disease really comes down to that, right? And
Yes.
most things are certainly breast health is all about, and certainly cancer is all about inflammation. So the more we can bring down inflammation, the more we can actually prevent the cancer from setting up. It's not so much about the things that we're doing, it's about sort of risk factors, and I guess that does come back to the things that we're doing from a lifestyle standpoint. But cancer risk really comes through with lifestyle action and decisions that we're making, and ultimately those things that are related to inflammation.
Yeah, and that's a really important topic when you think about that. We're really moving into a world of genomics, or the understanding of how our genetic coding can't be changed or predisposes and therefore perhaps predetermines that you will develop these diseases and these conditions, and cancer is one of those conditions. And we would adamantly say that just because you have a genetic predisposition to a condition like breast cancer by no means mandates that will happen. Your lifestyle choices, and then having the wisdom of saying, I'm in an inflamed state, what do I do to correct that and therefore prevent cancer from manifesting, is a really important topic.
It is, and you're talking about epigenetics. So this is the idea that we're not just simply a bag of DNA that we have no choice on what's going to happen, that everything's just predestined, but that DNA is affected by lifestyle choices, by what we're doing from a day-to-day basis, and maybe decreasing inflammation. We keep coming back to that word. And
practicing prevention, which we do have. You've heard us say before that our patient base is kind of divided up into two populations. It's those people that are searching for optimization, that maybe they feel well but they don't feel fantastic, and they know they could and they want to, so they do things to do that. The other population is already diagnosed with some form of disease, and we do our best to first correct that, or at least manage symptoms, and then take them to optimization. When you're thinking about your genetic predisposition, it really helps you have information so that you never head down the path of disease presentation. You can just keep moving forward in the world of prevention.
Yeah, and sometimes we might not even know anything about our genetics, so practicing a healthy lifestyle is the great way to prevent that anyway, regardless of whatever your predisposition is from a genetic standpoint. So
this is where peptides
come in. Yeah, for sure. And peptides are definitely hormones. These are small little amino acid chains that are just small proteins that help to convince the body to do certain things depending on which tissue it's stimulating. So last week we talked about certain types of peptides that will affect the pituitary gland to help you to make and produce, or really secrete, growth hormone, right? And that was pretty exciting. And we're seeing great things here at the Hormone Zone regarding the use of these different peptides to help with growth hormone stimulation. It's been actually a lot of fun to see the results of that. It's really cool to see the research manifest into something that's really practical for patients, and seeing that right there in the trenches.
Yeah, and that it's so easy to do. It's easy to use, it's easy to understand, and patients are really identifying with that treatment protocol. there's no better cure than compliance. I mean, we can have the best ideas in the world, but if you're not doing it, then forget it. It doesn't matter. And the nice thing about working with peptides is you're hearing it here. This is the future of hormone replacement. I mean, it's a really exciting place to be because you're cutting edge, but like we always say, you've got plenty of research, tried and true, that says these are safe therapies, and we would encourage you to experiment with them. So, Thymosin.
Well, and that's also a good segue. Thymosins, this is a lot of research. It goes back several decades. Where thymosins are coming from is your thymus gland, which is a small gland, and especially for adults, it's a very small gland. It has a lot to do with regulating the immune system and secreting immune cells, T cells in particular, T, thymus. So the thymosins are particularly helping with immune modulation and anti-inflammation. So we're right back to inflammation.
Yeah, and the word immune modulator refers to any chemical that can either upregulate your immune system or in some cases downregulate your immune system. Let's say when you're having an exaggerated autoimmune reaction. In the case of this thymosin peptide, we're looking at a chemical component, an amino acid, a peptide here, that is stimulating your own immune system so that you have improved health. Why?
Well, because sometimes I'm either staring at you this way or I'm staring at you that way, and sometimes it just makes me smile. I
feel like a fabulous video in and of itself would be to like just cut and paste how often I interrupt myself talking, laughing as per John's visual look.
Yeah, it's staring at you.
All my teeth. Can you imagine minutes on end of my teeth?
Mesmerized.
Only I find that amusing.
What were we talking about?
Thymosin.
Thymosins. All right, look, there's two thymosins we want to talk about today, or particularly I want to talk about today. One is called thymosin alpha 1, and the other one is called thymosin beta 4.
I'm the alpha 1.
Right now you're alpha 1.
Who agrees with me?
Once we're done with this, we'll have to talk. But both are, and the beta's probably better anyway. That's what we're talking. So there's many different types of thymosins, and this is just two of the main ones that have been synthesized that we can actually use. So the thymosin alpha 1, now this one is a little bit more immune modulating, just what Christina was saying. But it does have the ability to very much stimulate T cell. And what's interesting about thymosin alpha 1, it's in phase 3 clinical trials right now for hepatitis C, and phase 2 clinical trials for hepatitis B. So they're already out there doing it. These are normally you got to get to phase 4, and then it kind of gets put into general, understanding with use.
So for those of you out there who want to better understand the notion of the clinical trials, in anything that has to do with medicine, especially for humans, the vet world I think has different standards, but you always go through research first. So that's the stuff that gets tested in the labs, and then it has to go through a series of checking it out, clinical applications, how is this safe and effective for humans. So the closer we get to that phase 4, then the sooner we've got it at our fingertips, more commonly available.
Right, more commonly available, and I think that's what's important here because, again, it's been available. There's just a plethora of research behind it, and through the fact that we can have access through compounding pharmacies, we can get these things now. And that's the great thing. This is what we talked about last week, too. When it comes to peptide therapy, it's so clinically forgiving. The side effect profile is really, really low, so the safety factor is already in place. But back to the thymosin alpha 1, it's also being used with chronic fatigue and Lyme's disease. So a lot of doctors are using it in this particular way because it is so immune modulating and even helping with cancer. So it's stimulating T cells. There's an augmentation that's happening with T cells. So that's the thymosin alpha 1. Now, thymosin beta 4, this is really anti-inflammatory, and I think this is the one that we're starting to see maybe some good utility for us right here at the Hormone Zone in working with thyroid disease. So when it comes to Hashimoto's, or most thyroid disease really is coming from some kind of inflammatory process. So if we can use something that's very natural and immune stimulating and modulating all at the same time while bringing down inflammation, that's where this thymosin beta 4 might come into play. And the other really cool thing, it's tissue. So this is something, thymosin beta 4 is being used with actual tissue repair. So athletes, acute injuries, even the old athlete is maybe dealing with something for a long time, this can actually start to go in and really start to clean things up and modulate the immune system in such a way to actually repair the tissue because it's so anti-inflammatory.
Right, so essentially what we're saying is that you can take this very safe peptide that is going to have systemic benefits because it's anti-inflammatory and immune modulating, and it will help let's say with an acute injury or chronic injury, those chronic injuries are really important because those are often the things that will take someone, the difference between their early 40s to their mid 50s, where they're just not as active as they are. And that's really when you start to see the effect of that sedentary lifestyle because, oh, my old football injury. Well, if you now have this tool that, again, with a safety protocol that is basically foolproof, then you know that you can start to repair those injuries and get back to that place of optimization that you've been searching for.
Yeah, that's the other thing, and that's the title of what we're talking about here. It's also anti-aging. So the thymosins and peptides in general are very anti-aging, and so, or age management, what we think is a better term anyway, graceful aging.
Graceful aging.
Yeah, right. And so when we're talking about anti-aging and helping to prevent disease, that's really what it's about. It's prevention, and that's what we're getting. When you bring down inflammation, because cardiovascular disease, diabetes, these types of things are inflammatory based.
Right.
So if we can regulate the inflammation process, then we are really being age management minded in our approach with which tools we're using.
Yeah, I mean, we always think, okay, what is the purpose of this video for this week? The purpose of these videos are to continuously bring you tidbits of information that you can easily process and then be armed with what is my plan for graceful aging, what is my plan for disease management, what is my plan for disease prevention, and then take it with you and address it with your physician or with your family members, your loved ones that are afflicted, or of course bring it back to the hormone zone and say, hey, I've got this irritable bowel condition. Am I a candidate for immune modulation? Is thymosin the right tool for me? So use the information that we're giving you to create a plan, just like you would do for your financial plan, to say, how do I ensure that my future is guaranteed to be as graceful and enjoyable as possible?
Yeah, and that's all back to comprehension. We're constantly looking at how comprehensive we can be with this idea of lifestyle.
Yeah.
And we want to make sure that these things are results driven, and they really are. We want to make sure people are feeling better, but keep to that process and that promise of health through lifestyle and constant movement towards comprehensive care.
Yeah. Hi, Freddie. Now that's
Hello,
a great
hey, Freddie.
example of someone who prioritized graceful aging. There's no point in your life that you give up having a good time, pushing your body to the limits, but with respect, because the point is not to work so hard that you tear yourself apart. The point is to, live on the edge and have a great time, and then be able to rest, recover, and repeat. So.
Because Freddie is 178 years old. You just don't know that. I mean, because he looks like he's barely 40, but he's 178. and he's still kicking butt. Hey,
That's
Freddie.
Right.
So, what else did you want to talk about? Anything else? How do we bring this back to sex?
He's been doing this to me lately, right?
I'm
I don't
pinning
know
it on
why.
her.
It's all about me, but fine. I'll bring it all back to sex. I'll bring it all back to chocolate first. Let's talk about chocolate. No, I think that if you take your thymosin with a cup of dark cocoa, really dark cocoa, which is great for the lining of your blood vessels, you've got the immune modulating effect of the thymosin, which is going to help you prevent disease as well as manage your current state of inflammation. You sip it down with some hot chocolate. I don't know, I'm making this up clearly. And then you go and you have some sex. How does it work? It works because one of the things that we've encouraged you to do in the past is to get creative with your physical intimacy. Getting creative with your physical intimacy, you may remember from some of the episodes you've seen us do before, not only triggers the meditative part of your brain, but is also burning calories and is also stimulating to your endogenous, remember, self-hormone production. So imagine, if you're decreasing inflammation, you're repairing your injuries, you're getting more creative, you can hit that Kama Sutra a little bit more enthusiastically without fear of injury, because you know you've got a tool in your backyard that will help you repair. I don't know. Loose?
In your backyard? Did you mean back pocket? I'm thinking like a tool. Okay.
Was that a loose connection?
No,
No, thank you.
probably
Let me get
true.
some bubbles up there. Bubbles of approval.
Likes, please.
All right, great.
I think that was all very well said. And so here's what we definitely know for sure.
Hormones are sexy.
And healthy is a lifestyle.
That's right.
And we really enjoy doing this one. Next week, what are we talking about next week?
I don't remember. Men's health?
No, maybe it is men's health.
We've had some private messaging. We love that, so please do bring it out. We don't want our content to be too heavy or too boring. We want to stay cutting edge, so we want to introduce you to things that maybe you didn't even know you were interested in. Thymosin and the
Yeah.
peptide therapy is one of those things. But of course, we're welcome to address specific questions.
Before we go, we have a quick announcement too.
Yes.
Two quick announcements. One, on the 27th, it is our 5-year anniversary. So I have been blessed to be with this beautiful woman for 5 years in terms of having that official certificate,
right, the certificate.
having the certificate, even though it's been many years before
Yes.
that. But we've been official for 5 years, and I love you, and it's really been an amazing 5 years. And I look forward to 55 more at least, and I guess with Thymosins and all these other things, we're going to be able to, do the long haul. The other announcement that we wanted to make is that if you do have questions about anything, but particularly about sex, you can now send an email to 480sexdocs@gmail.com, and these are specific questions that are going to be addressed through our new column with the AZ Foothills, Arizona Foothills.
So that's very exciting. We're happy to be health and wellness experts for that fabulous magazine.
So check us out. Check out the magazine. We'll be routinely talking about, answering all these great questions, and then also questions you might have right here on Facebook Live. We're here for you. So thanks again, and we'll see you next week, Tuesday at 12:30.
Have a great. Ooh, I think it's Halloween.
Ooh, yeah.
Have a wonderful
I know what
week.
we're talking about. I remember that. Just reminded me. We're talking about sexy, healthy candy. I think there was something
That sounds like
that.
my idea.
I don't know how much research will be behind all of that.
Chocolate.
No, we'll find the research. I'll dig it up no matter
Goodness.
what. All right,
All right,
see you
well,
then.
thank you. Have a wonderful week. Bye-bye.